Welcome to the City Club of Eugene's December 4th, 2020 program, COVID-19, Where We Are and Where We're Going. This is the 12th program for our 2020-2021 programming year. My name's Scott Coltrane, and I'm the City Club President. Support for the City Club is provided by our members and sponsors. You can become a member of the City Club at our website, cityclubofeugene.org. Our programs are always available on our YouTube channel and on our Facebook page, and are rebroadcast on public radio station KLCC FM 89.7 on Mondays at 7 p.m. We have both business and in-kind sponsors, including our diamond sponsors. Kaiser Permanente exists to provide high-quality, affordable healthcare services and to improve the health of our members and the communities we serve. More information at www.kp.org. Support comes from the University of Oregon. Since 1876, UO has helped Oregonians question critically, think logically, reason effectively, communicate clearly, act creatively, and live ethically. More information at uoregon.edu. PeaceHealth is proud to serve Eugene, Lane County, and beyond. As your hometown healthcare partner for more than 80 years, our mission is to keep you and your family healthy. Learn more at peacehealth.org. Lane Community College transforms lives through learning. LCC provides comprehensive, accessible, high-quality educational opportunities that promote student success. For more information, visit lanecc.edu. We would also like to acknowledge the very generous support from the City of Eugene and from Lane County. On to today's program. As feared, the combination of colder weather and pandemic fatigue is producing a spike in COVID-19 cases, hospitalizations, and deaths in Oregon and around the country. As daily infection figures in Oregon soared above 1,000 for the first time, Governor Kate Brown issued a 2-week freeze effective November 18th with additional restrictions on businesses and public and private gatherings. Today's program, airing after the conclusion of the 2-week period, is intended to update the community on the current state of the pandemic. Presenters include some of the most accomplished and influential public health officials in our region. They will focus on the mental and physical toll COVID-19 has taken on the local community, particularly on the challenges faced by families and children. While recent reports provide some hope for a safe and effective vaccine, questions remain about when it will be available to the public. As we head into winter, no program could be more timely. I would like to thank Joel Koren, Karin Knutson, and Andrew Kollick for coordinating today's program. Speakers include Patrick Luedtke, MD, a preventative medicine and primary care physician who serves as Lane County's Senior Public Health Officer and as the Chief Medical Officer for the 9 divisions and 6 clinics of the county's Department of Health and Human Services. James McGovern, MD, is Vice President of Medical Affairs for the PeaceHealth Oregon Network. A former hospitalist and experienced physician leader, Dr. McGovern came to PeaceHealth in April 2019 from Wisconsin-based ThedaCare, where he served in several leadership roles, including System Vice President of Medical Affairs. Leslie Pelinka, MD, has been part of PeaceHealth Medical Group Pediatrics since 2007. She completed her medical education at the University of Utah School of Medicine and her pediatrics internship and residency at University of California, San Francisco. In addition to seeing patients in a primary care clinic at PeaceHealth, she works as a pediatric hospitalist at Riverbend Medical Center. Ellen Thornton-Love, LCSW, has been the clinical supervisor for Lane County Behavioral Health Child and Adolescent Program since 2015. Ms. Thornton-Love has specialized training in child development and an interest in treating children and adolescents with trauma, complicated grief, attachment issues, and mood disorders. Dr. Luedtke, I turn it over to you.
Hello, I'm Dr. Patrick Luedtke, the Senior Public Health Officer for Lane County Public Health. Today, I'm going to be speaking about the COVID experience thus far. And it occurs to me that today marks 9 months since the first person in Lane County became positive for COVID. And that 9-month time frame has really played out in interesting ways. And I'm going to break that experience down really in trimesters, sort of like a pregnancy. It has sort of seemed a bit like that. The first trimester, as many of you will recall, March, April, and May, was really the stay home, save lives time, and looking at the experiences that other countries and other states had in the COVID space and how we could learn from them. And it was a real challenging time. We were looking at a virus that was really seen as an outside invader coming into our community. Most of the cases were linked to persons who had traveled. They were on cruise ships. They had traveled from other countries. And it wasn't really a sense that it was a virus that was here and transmitted and occurring in our communities until the second trimester, which is June, July, and August. In that time, we opened our communities slowly, and we began to experience some transmission locally and realized as a community, as a state, as a country, that the virus was here to stay, and we really needed to start planning what that might look like in the fall. And of course, that planning was really deep. There was planning in school systems with businesses, planning at our colleges and universities. Many entities were planning for what might happen in the fall. And of course, the third trimester came, September, October, November, and we saw huge challenges with the number of cases beginning in mid-September. It took us 6 months to get our first 1,000 cases of COVID in Lane County. It took 30 days to get 1,000 cases moving from 2 to 3,000. It only took 10 days to get the next 1,000 cases moving from 3,000 to 4,000 cases. We've had a marked increase in this third trimester, so to speak, of this pandemic that has really made us all concerned. But the heartening side of all of this is those plans that we worked on really hard in those summer months, planning with schools, planning with businesses, colleges and universities, planning with the general public, were able to be operationalized in this third trimester. And we have seen a great deal of that work come to fruition and be successful. But of course, there are ongoing challenges. So here we are, early December, and we have now, I guess, for lack of a better metaphor, given birth to what we have given birth to. And how do we move forward and raise up this entity of response to COVID? And there are many other pieces moving forward in that space. First, vaccines. I think there are many persons who are really heartened by this landmark short time frame of creating vaccines and getting them to market in the same year, which of course has never happened before. And it's fascinating that we will get a vaccine in small numbers by the end of this month in Lane County, and then larger volumes in the first quarter and second quarter of next year. And the planning for that vaccine is really multifactorial. We first need to make sure that each of us in the clinical space, the public health space, fully understand the use of those vaccines. And we have tracking systems to make sure that because they're mostly 2-dose vaccines, we are able to track the first dose and get the second dose at the right time. Then we need to work with our lay community. Those of you who will become vaccinated, or we hope you will choose to be vaccinated, how do we make sure you have all the information that you need to make the right decision for yourself, for your family, for your community? Those are big operational plans we're working really hard at in local public health and at the state and national levels. In addition, we need to move forward with the other training and opportunities in the infection control space. Many have heard of the initiatives and the requirements that are really time tested in respiratory outbreaks, including cover your cough and sneeze, now wearing a mask, including this physical distancing, avoiding large crowds, and hand hygiene. But when you have a pandemic, we have to do other things too. And we need to do some of those items that we really hadn't done much before, like cleaning high-touch surfaces repeatedly. These products that we use to clean doorknobs and the handle of the refrigerator and your computer keyboard, those areas that we all use in a large volume, are something we typically don't do in a regular non-pandemic event. And we need to consider those and keep up those walls of defense, for lack of a better phrase. And then finally, as we also move forward in this public space, we need to plan for how it is that we're going to work collectively to bring our society back to at least some sense of normalcy. And with the vaccine on the horizon, some other antivirals coming online, and these antibody cocktails that have been approved recently, we can see the end of this pandemic. Clearly on the horizon, we can see the end of it. We will not break the back of this pandemic overnight. We're going to go from a worldwide pandemic to large regional outbreaks, to smaller regional outbreaks, and then scattered outbreaks over the course of several months. But we can see the end of this now, which is really heartening to each of us in the clinical and public health spaces. I'm going to stop there. I'm going to pitch it to Dr. Jim McGovern from PeaceHealth. Jim, it's all yours.
Thanks, Pat. Hi, I'm Dr. Jim McGovern. I'm Vice President of Medical Affairs for PeaceHealth's Oregon Network, and I've also had the honor and pleasure to be the incident commander for our Oregon response to COVID. So my role, I think, was really to coordinate the team that has been working on our COVID response. So thinking about Pat's comment, it feels like a lot longer than 9 months. And we probably also went in 3 phases. The first one was really a flurry of activity. We took a number of people offline, completely off their normal jobs, and had them dedicated to the COVID response. So our EVS, our housekeeping, our physicians, our infection prevention, nursing, so many others basically worked for 2 months straight to put in planning. So what does day-to-day care of a COVID patient look like? How do we keep our caregivers safe? How do we transport patients with COVID through our building? How do we take them from EMS? How do we transport them from Peace Harbor, Cottage Grove, University District to Riverbend? We made the decision early on to have Riverbend be our core COVID hospital for a number of reasons. The resources are there, the specialized physicians, the ICUs, the ventilators. Rather than try and disperse the expertise and the knowledge throughout 4 different facilities, we really consolidated into one. So we put a lot of effort into contingency planning, day-to-day planning early. And then we went into that kind of middle phase where we went back to our normal jobs for the most part and just waited. The early summer months, as Pat alluded to, were really quiet. We had maybe 1 or 2 patients in the hospital at any given time. At one point in time, we only reserved 3 beds for COVID patients, and they were empty more often than not. Then Labor Day came, and we've been much busier. Again, in correlation to Pat's increasing, the 1,000 cases by 1,000 cases, we've seen our hospital census go from 1 to 2 patients to 4 to 5 patients to 10 to 15, whereas now we're sitting at somewhere between 25 and 30 patients in a typical day. We have capacity. We can go up to 12 ICU beds. Right now we can go beyond that if we need to. I would say we can manage comfortably 12. Right now we have 36 of our medical surgical unit beds set aside for COVID, 23 currently in-house. So we have the ability to take care of a decent number. If the numbers continue to increase, we'll have capacity issues. We will have nursing, physician, getting the staff with the ability to take care of patients in addition to our physical beds will become an issue. We did have to scale back elective surgery early on. Our surgeons actually made that decision a couple of days before the governor sort of decreed it. And during the summer months, I mean, when we were not having elective surgeries, the hospital was pretty much empty. Now we're managing surgery schedules in addition to COVID patients and doing that quite well at present time and present volumes. But we are working with our surgeons in order to be able to continue to serve the community, people with back pain, hip pain, knee pain, cancer that needs surgical services. We want to continue to be able to provide those services to the community and take care of COVID at the same time for as long as we safely can do both. That is a lot of our work day to day right now, is to be able to make sure that we can safely serve you and continue to take care of the patients who need us for COVID. So we've built a lot of capacity. We've worked contingency plans. You know, we are managing visitors. With the explosion in COVID in the community, it impacts our staff as well. So right now our staffing is adequate. We're concerned with a flu season as well as COVID on top of that, that our staff gets sick too, just like other community members. So making sure that our staff and the community wash hands, wear masks, socially distance, keep those holiday gatherings small to prevent the spread helps us both maintain hospital capacity to care for the community and keep our staff healthy so that they can come to work and take care of people as well. You know, our staff has been doing this for 9 months. If you pull back the curtain and look at what's been going on in the hospital for the last 9 months, COVID has been an experience in change. We have learned a lot about the virus, much more than we knew in the beginning. And with each learning, with each new discovery about COVID and how it acts, we've changed our processes. So our staff have changed fatigue. We have changed processes, testing. You know, our system has done a really good job here at PeaceHealth to provide us with multiple platforms. We can test everybody who comes into the building every day and get results within 2 to 3 hours for our patients. But with that comes changes in the decision trees, the algorithms. Our PPE, or protective gear use, has changed as well. So change fatigue impacts our staff. And to some degree, social isolation. One of the most dangerous places in a hospital is the break room, where people are not masked, they're eating, they're in relatively small spaces in close proximity. We've done some things to adjust that, but that means they either take a break by themselves or maybe take a break with one other person. So that social interaction at work has been difficult. The anxiety of working on a COVID unit in an emergency department where you don't know who has COVID or who doesn't, that builds stress in our caregivers as well. So anxiety, stress, change fatigue, all those things kind of build. But at the same time, I have to give huge credit to our staff who take care of these patients. We have family members in ICUs together who have COVID. Our staff does a tremendous job managing and giving emotional support to people who are in distress and in very difficult situations in their lives. So while they have their own stresses and anxieties, they put themselves out there for others. So looking forward to the vaccine, we hope to be getting vaccine supply in the next couple of weeks, no guarantees. I believe our frontline caregivers are first on the list, and we'll work through getting them vaccinated, and then the next phase will come. So that has also been a tremendous amount of work that the PeaceHealth system has taken on, that luckily we in the network don't have to manage all the logistics of. So I think that's kind of my part as far as talking about the hospital and our preparation for COVID. So with that, I will give it to Dr. Thornton-Love.
This is Thornton-Love. I'm a licensed clinical social worker and supervisor for the Child and Adolescent Program at Lane County Behavioral Health. And I was specifically going to talk about the mental health issues and suicidality of youth and adolescents in our community related directly to COVID. And also going to provide some possible ways that people can support youth with some different trainings and things that are available that lay people can take that also can help talk with the youth or adolescent when they're in crisis, as well as young adults, which we serve here. So there has been, according to the Centers of Disease Control, about a 28 to 30% increase in youth and children and adolescents with diagnosable mental health issues related to COVID. And so that is what we've been looking at here, and we've seen that here as well. We've definitely seen an increase. We were able to start serving clients very quickly due to being able to access telehealth rapidly in our system. So we only went about 2 weeks where we weren't able to provide face-to-face care via telehealth with the onset of COVID. We initially were providing treatment through telephone, and now we provide a combination of in-person, telephone, and telehealth. So we were able to offer continuous treatment. Initially, we didn't see a big spike. The first spike we saw in youth experiencing problems was in the younger child population, toddlers and early grade school, primary grades. In the past month or so, we've seen a really big increase in adolescents really struggling, and middle school age youth really struggling with the ongoing telehealth. And initially also seniors who are graduating really experienced a lot of problems of what their future would look like. And we've continued to serve some of those youth, and they continue to wonder about what it's going to look like with college maybe being put on hold because they didn't want to go to college online, or wondering how long this is going to go on and the real impact it will have on their lives. So we've just been providing them support. So the biggest increases that we have seen are in anxiety and depression. And typical symptoms of depression that we are seeing is a lot of feelings of helplessness, hopelessness, a lack of energy or ability to continue to focus on school. Some of them are saying there just isn't any point. Some of them are feeling very let down, that they're letting themselves down by their struggles that they're having and not being able to meet their academic requirements, or just lacking that energy. Some of them, and the other big thing is anxiety, just general worries. How am I going to get everything done? Feeling overwhelmed, no matter what they do, it won't be enough. And that is definitely affecting their functioning. Also, many are worried that something bad will happen to them or their families are experiencing extreme financial distress with loss of jobs and employment, and that having a trickle-down effect on both the younger children, middle school and adolescents. Some of our kids are being required to care for their younger siblings because their parents have to work, and so that's putting a pressure on them in addition to trying to completing their own schoolwork. So those are some of the typical stressors that we're seeing of youth in our community. And I would say some really good trainings that are available, which I thought I would send in. Maybe we can, I don't know, put a screen that has them, is mental health first aid, which is a free training on just how to talk about mental health with children, youth, or adults that are in crisis and trying to assess for risk. That's a free training that is offered all over the community. A main resource for that to find out where it's being offered is at mentalhealthfirstaid.org. Oregon Family Support Network and the National Alliance for the Mentally Ill in Oregon, as well as the Suicide Prevention Coalition, all have access to providing you with training on that area. Another one is CALM, which is a discussion of lethal means. So being able to talk to somebody and assess whether or not they need to have firearms and medication and safety plans around that. And it is a free training as well, also offered by the Suicide Prevention Coalition of Lane County, as well as on the SPRC, which is the Suicide Prevention Lifeline, has a link to that. And it can be very helpful in order reducing lethal means with suicide. So that is just a few of the resources that are available. We've been providing a lot of referral sources to people in our community. So if they call Lane County Behavioral Health, we have resources where they can access treatment, and we can make referrals. A good place for people to start who are noticing that children and adolescents and younger children and their families are having problems is they can contact their health insurance plans and find out who is available in their community to provide those services. Many insurance companies have what they call a care provider team, and I always recommend to people that is the best way to get more direct resource and referrals. They can also talk with their primary care physician and get referrals for help. Many primary care providers do screenings for both anxiety and depression, and then can see if there's really needed. And I know we work directly with many of the pediatric providers in our community to provide those resources. And then also we make referrals out. If we can't serve them here, people call us all the time. We keep referral lists, and we work with both Trillium and Pacific Source to find out where people can access treatment. So those are just some of the things that we're doing right now due to people being in mental health crisis, and particularly children and adolescents and families. We are seeing an increase of families in crisis due to substance abuse and financial pressures. And we're working really hard to try to help them access what they need to get help. We work with Department of Health and Human Services if needed to try to reduce the crises, and also work with even within our own agency to try to get mental health supports for the parents of children and adolescents who are struggling because their issues impact the functioning of their kids. So those are some of the things that we're doing here to try to mitigate mental health crises and suicide risk for youth. We also are working with the Suicide Prevention Coalition of Lane County, who received some monies through the Garrett Lee Smith Act, and it's specifically about suicide reduction. So we are working directly with schools, helping to provide education, how to assess and get help for youth that they're kind of seeing they're risky or at risk of needing extra help. Even some of the teachers now are starting to notice things and trying to get help for youth through their counseling department and getting referrals for treatment. So that is what I had to talk about, I believe. They're also just, we're also working with our CCOs to help people who don't have access to technology to do telehealth to get those services. So Dr. Pelinka, take it away.
Thank you.
Kim.
I'm Leslie Flinka. I work as a general pediatrician both in primary care clinics and in the hospital at Riverbend Medical Center on the pediatric hospitalist service. So I wanted to just touch on and add my perspective to a couple of things that Ms. Thornton-Love just spoke about. We in primary care clinic are seeing and often are the first people to screen for what is an increasing number of adolescents coming through with struggles emotionally, behaviorally, and academically. Like Ms. Thornton-Love said, we do screenings and testing for those conditions as well as those that often go hand in hand with them, like attention deficit hyperactivity disorder or ADHD and other learning difficulties. We're seeing numbers like never before as parents are bringing in children for these kind of evaluations. Every week we go deeper and deeper into COVID. Younger children are struggling behaviorally, emotionally as well, and in these little ones it often is manifest in physical complaints like headache and stomach ache, or just feeling generally unwell or fatigued. We do our due diligence with good examination and testing, but it's almost always normal. So we're seeing an increase in what we call functional illness, which is symptoms that are physical without physiologic basis. These often blossom during times of intense psychological distress for children in particular. In the hospital, where we work as a pediatric hospitalist service, we're seeing admitted to the pediatric unit a steady stream, unfortunately, of adolescents who attempt to end their lives with primarily toxic ingestions of medications or drugs. They're frequently determined by our consulting psychiatry team to be actively at risk of suicide if they were to be released. And so they're waiting days to weeks in our hospital beds, waiting for a vacancy in one of the few adolescent inpatient psychiatric units up in Portland. Scarcity of those placements has always been an issue, but of course, now more than ever. Beyond mental health, one of the biggest issues facing us in pediatrics locally and nationally is a steep rise in obesity. And of course, this has been an epidemic that we've been struggling with as a nation for a couple of decades, but since COVID has struck, the rise of the BMI, the body mass index, which is what we use to track obesity, has risen very steeply and at an alarming rate. All of us are noticing this in clinic. This is in part because of or in part because of the closure of schools and other organized opportunities for physical activity. Even where some community activities have worked really hard to stay open, they often require resources of funds and transportation that just make them not possible options for our most vulnerable families. And even for families that do have resources, there's a fear of exposure to the virus, and a lot of children are just staying home as by choice from their families. When we talk about managing obesity in normal circumstances, we talk, of course, about this physical activity, but also about the areas of nutrition and screen time. And these are also suffering. Parents are stretched really thin these days. You can imagine with the juggle of balancing employment, which may have been shifting, homeschool supervision and childcare needs, which have now increased. Parents are also stressed by having COVID high on this list of things that they feel threatened by, both for themselves and the children they're trying to protect. They're also suffering from anxiety and depression. Financial constraints for families are increased for many with changes of employment, or as parents are needing to stay home to provide childcare and homeschool supervision. So all of this translates into increased difficulty getting well-balanced meals on the table or keeping the shelf stocked with healthy foods. And then there's screen time. So parents struggle in normal times to manage screen times, especially for their adolescents. But what I'm hearing in clinic, and is echoed by my partners, that the number of hours that children are spending on screens is often 8 hours or more per day. Some of this, of course, is in live instruction with their teachers, but much of it is not. I'm hearing of children who are staying awake until 1, 2, 4 o'clock in the morning in their rooms under their covers on their phones, sometimes unknown to their parents. Schedules and wake times have shifted significantly as well. Social media is very tricky to navigate and keep tabs on for parents, and is of great concern. We want children at this time to be able to connect to their friends, and we want them to be able to explore some part of the world outside of their own homes, but staying engrossed in social media that at best distorts reality and at worst provides a real platform for bullying is very concerning. Sleep is also affected by screen time. The blue light emitted from the screens of most electronic devices is stimulating to the brain and chases off the onset of sleep that comes naturally. Children and adolescents can stay awake for hours without even realizing it, and certainly without recognizing what would be their natural cues for sleep. Proper rest, of course, is vital for good mental health, alertness, and energy. And so sleep deprivation contributes to depression, anxiety, school difficulties, attention deficit, and obesity. COVID era is putting our children at risk in other ways. The education that children are being deprived of at this time of distance learning is significant, and in some cases is irreversible. The World Health Organization recently published concerns that, quote, the longer that marginalized children are out of school, the less likely that they are to return. Harms are greater for children of migrants, refugees and minorities, and children living with disabilities, close quote. One of the very dark sides of the pandemic is the increased potential for child abuse. With schools and activities closed and children primarily confined to their homes, there's a lack of eyes on our community's children during this time. Children who are usually watched and observed daily by teachers, coaches, and instructors are now largely hidden from view. Locally and nationwide, there is actually a report of less child abuse overall, but more cases of acute and severe abuse on presentation. The concern, of course, is that children who are being abused mildly are not coming to our attention early, and that abuse can escalate undetected to a severe degree before these children are being found and helped. The acute cases indicate that families who were previously functional are now struggling more during COVID and struggling not to snap and harm their children. Now there's new emerging evidence that with careful precautions like masking and social distancing and hand hygiene, schools in the US and worldwide have not proven to be the source of COVID outbreaks as had been feared. Oregon is looking at trying to bring back at least a hybrid system with some live learning in the new year, and this is exciting news. We need to get these children back in their schools and start the recovery from the negative consequences of our current distance learning system. There's a lot we can't control right now, and some acceptance of that is healthy. It's also healthy to channel our efforts to what we can control. So when I meet with parents and children in clinic who share all of these concerns that I've spoken about, I give some combination of these very concrete recommendations or suggestions. Number one, establish a routine. Children generally respond well to structure. Adolescents may not respond well to it, but unknowingly they perform better with a predictable, consistent schedule for schoolwork, household chores, mealtimes, and bedtime. Number two, along with creating consistent bedtimes for your children, plan to put the phones and electronic devices to bed also. Having a central home or charging station for all devices within the household, preferably someplace supervised, like a parent's bedroom, will prevent the obvious pitfalls of being on the phone late into the night. The phone should go to bed about an hour before the child is expected to. This will minimize the brain stimulation from that blue light from the screen and prevent insomnia. Number three, ask to review your child's social media from time to time. Remember that although your child may feel the phone is theirs, the household rules are yours as the parent. You don't need to spy on your children or review every text sent between friends, but having a glimpse into what social media they participate in and getting a feeling for generally whether things are positive or negative on this important aspect of their life is important to stay in touch with. Number four, try to prepare some home prepared foods, even when it's really difficult, and keep the shelves stocked with healthy snacks like fresh fruits and vegetables or protein packed foods like nuts and cheese. Next, plan on being active outside. There is a strong chance still that schools, gyms, and activities will not open this winter, so we need a plan B. It's time now to get geared up and get get clothing for warm or cold and wet weather so that people can get outside. Make a plan. Choose a designated family member as your walking buddy, or go at a consistent time every day. Find some motivation spending time with your dog on a walk or having some time reserved just to listen to your favorite music. Pick a plan and just go outside. Next, if your children are struggling emotionally or academically, reach out, like Ms. Thornton-Love said, to your primary care pediatrician. There are resources we can connect you with around our community or at the schools. And a lot of this is available virtually right now, and it's not ideal, but sometimes just making that first connection to someone who can help you with your child's emotional or academic struggles can help reduce everyone's anxiety surrounding this issue and kind of turn that momentum in a positive direction. And lastly, get the flu vaccine. We're starting to see cases of influenza break in Oregon, and it's just a matter of time until we're in the throes of full-blown influenza season. The vaccine for influenza is not perfect, but it is what we have. So even in years when it's only 50% effective in preventing influenza, I like to say that 50% is a lot better than zero. And even more important than individual protection for each of us is the community protection we provide when we are vaccinated in sufficient numbers within our county. Those who are unable to get the vaccine, like little babies that we see who aren't of age to receive it, benefit from the herd immunity we provide if we create that layer of insulation for them. We are seeing in our clinics more families than ever open to receiving the flu vaccine, which is really encouraging. And we've even pulled off a couple of drive-through vaccine clinics for pediatrics. People seem to understand that this is the year, if ever there was one, to take care of preventing influenza where we can, so we can avoid a concurrent spike of both COVID and influenza in these winter months. So that's the state of pediatrics here in COVID. Thanks for your time. I believe we're going to take a short break and then come back for a panel discussion.
I'm Joel Corin with the Program Committee of the City Club of Eugene, and I'm going to engage the speakers in some follow-up questions based on their presentations. The first thing I'd like to talk about is what to expect from the vaccines. When can we expect that the general public will be vaccinated? What will be the priorities for the vaccinations? And I'd also like some discussion about the various vaccines that are out there. Do we know what will be coming here? Dr. Luedtke, we'll start with you.
Happy to discuss that. Thank you, Joel. So good timing, because this week the Advisory Committee on Immunization Practices, we call that ACIP, meets to discuss that exact issue. The vaccines are coming. What will be the priority groups to receive them first? And this is really important, not just epidemiologically to say, how do we get the biggest bang for the buck, but also we're not going to have enough vaccine for the 331 million Americans that exist. We have a small amount of vaccine that's going to come out in late December, and then a good deal more January going forward. So number one, that group meets this week, and we're anxious to hear their priority groups. Almost certainly, priority groups will include healthcare workers, first responders, and perhaps in that first tier of vaccine receivers, persons who are at high risk for disease. So that's what we're expecting, but we'll see what that group comes up with today. And then you also wondered about looking forward regarding vaccine. So on December 10th, the FDA will review the first submission to approve a COVID vaccine in the United States. That vaccine submission is from Pfizer, the pharmaceutical company, and their vaccine is a sort of a novel vaccine, messenger RNA. It's a new technology. It's been researched for a long time, but on the 10th of December, that will be reviewed, and perhaps at the end of that day, we will find that we have a vaccine that's been approved. And since that company has already manufactured roughly 6 million doses, literally the next day, some might be sent off on airplanes, and we may get a trickle here in Lane County. Back to you, Joel.
Doctor, do we know where people will be able to get vaccines in Lane County? My understanding is at least one of the vaccines requires a very different and difficult type of storage than your normal drugstore or family practitioner.
So we do know that. Back in September, the Center for Disease Control mandated that all 50 states submit a COVID vaccine plan. And our state did that along with the other states, and some of our territories as well did the same. And then locally, all of us in the local health departments, Oregon has 33 local health departments, we are actively working on our local vaccine plan, and Lane County Public Health is doing that. So that's one whole piece of the vaccination plan. And it's worth mentioning that the last time we had a pandemic, H1N1 back in 2009, we did not have nearly the number of pharmacies that are able to vaccinate. Well, now most states have pharmacies that are able to vaccinate, some even vaccinate kids. So the federal government is working with large pharmacy chains, CVS and Rite Aid, other pharmacy chains, to provide vaccine to the communities too. So there will be at least two main pieces of access to vaccine in Lane County, the pharmacy side and then the clinical practices side. Back to you, Joel.
I would wondering what each of you are hearing about vaccines from the patients that you meet with. Are they likely to get a vaccine, or do they have anxiety about the vaccine? What are you hearing? Dr. Luedtke, we can start with you.
We are hearing a lot in the public health space and in our primary care clinics that the county runs. There are the typical questions that we hear in this vaccine hesitant time anyway. Questions about mercury, questions about side effects, questions about this sort of hurry up Operation Warp Speed and how was it made safe. And we respond to those based on all the data that we have. And we have some really compelling data to say that these vaccines are not only going to be effective, but they're going to be safe. But those are the types of questions that we're hearing. A little further downstream, we're hearing things like, will this be a vaccine like tetanus, where every 10 years I need a booster? Or will it be like the flu? I'm going to need one every year. So we're hearing questions like that as well as people think more deeply about it.
Do any of the other panelists have any response to that?
I can respond from a primary care perspective because patients are starting to come in, and as we are offering flu vaccine, they're asking, what are you hearing about COVID vaccine and how far down the road is it? People are concerned about it being a new vaccine and being rolled out so quickly. But I try to tell them the same way I feel about all of our vaccines, which is vaccine technology has been proven now for decades, and our best scientific minds are working on the national centers. And if there's one thing that I know that I do right in every day of my working life, it's vaccinating children. It's the one thing that we know is absolutely effective.
Joel, I might chime in here quickly, and I don't think any of us want to be an apologist for the vaccine manufacturers or the drug manufacturers. However, the vaccines that we've been using for some time, as Dr. Pelinka mentioned, there are many of those vaccines. They typically were approved with 3,000, 4,000, 5,000 persons in a phase 3 clinical trial. The Pfizer vaccine for COVID had 44,000 people in the trial, and they specifically chose people to be overly represented in high-risk groups, the elderly, persons of color, etc. So that gives you many, many, many more opportunities for observations, clinical and safety observations, to show that these vaccines are safe. And I'll mention one other thing. There are multiple non-governmental, non-industry groups that are reviewing all of these vaccines before they get approved. So we already mentioned ACIP. That's something we use all the time. It's a CDC private sector group of academics, researchers, etc., that make their recommendations, which are usually taken by the federal government, but not always. But there's also an FDA committee on vaccines and related biologicals. It's called VRBPAC, a long name, but they make their independent assessment. And then there's the data safety monitoring boards, the DSMBs, which I'm sure many people have heard about because some of the vaccine trials were stopped for a time, just back in September and October when there was a side effect and it couldn't be explained. And the data safety monitoring boards, they stop everything and say, hold on, we cannot proceed with further vaccination until we understand what happened. And then they independently say, okay, this was not vaccine related, we can proceed with the vaccine trial. So it's not as if these decisions are made just by the pharmaceutical company or just by government officials. There are a whole slew of people involved in determining the safety and moving forward.
Anyone else? Okay, I'd like to ask each of you, what is the main takeaway you want the public to get from your presentation today? And we'll start with Ms. Thornton-Love.
Yes, I would like them to know that it is good to be alert, looking out for your children, adolescents, and yourself to see how you're doing. It's sort of like putting the mask on yourself. So if you're yourself are experiencing anxiety, depression, and other mental health symptoms, to really also get help for yourself, as well as being able to look out for that of your family. Also that there are things that you can control, things like exercise, things like controlling screen time, getting support from others, and doing planning to really think about the holidays ahead, what you'll need, what you can control for and what you can't, and always remember to ask for help from others. They're there to support you.
Thank you. Dr. McGovern.
Sure. I would say we've spent months preparing for this. I've said it a number of times, however, we are here to take care of the community, and it's really the community who's going to determine what COVID does in Wayne County. The masking, not going to large parties, staying in those small gatherings, that the community's behaviors are going to determine our ability to take care of people who get COVID. So that for me is the biggest message and request, is to please, please, please mask, wash your hands, socially distance, and especially around the holidays. I know it's difficult. 2020 has been a miserable year. We've all lost a lot of things that are important to us. But if we can get through the next several holidays with social distancing and keeping things small, we stand a better chance of being able to take care of the community from the hospital systems ourselves, PeaceHealth, McKenzie, Willamette.
Dr. Pelinka.
So I would echo two things that Ms. Thornton-Love said. One of which is, I think people during COVID feel very isolated, alone, and sort of the more we feel isolated, alone, the more we are isolated, alone. It just seems to be a positive feedback cycle. But people are out there, so if you are struggling and if your children are struggling, reach out. There are resources out here. We're ready to connect and to help. We just have to know about you. And then in terms of pediatric physical health, just getting outside. It's going to be a long winter. We just have to prepare mentally to get ourselves and our families outside to get some level of physical activity and prevent further physical harm. From the pediatric side of things too, I would be a strong advocate for doing what we can to open schools. I know it's a politically charged issue and there are unions involved. There are a lot of sides to the argument, but from the side of pediatrics, the winning argument is clear that we've got to get our kids back into our schools.
Dr. Luedtke.
I would echo what Dr. McGovern said. We know how to decrease our risk. We don't know how to stop this pandemic, but we can certainly make it much more manageable. Tried and true items of avoiding large crowds, the physical distancing piece, wearing a mask, and cleaning those high-touch surfaces, including your hands, have made differences for literally hundreds of years. After all, the word quarantine comes from the Italian quaranta, when they used to quarantine ships for 40 days out in port before they were allowed to come ashore. That's where it comes from. We've known this for hundreds of years that it works. That's number one. Number two, the COVID vaccines are coming. With about 200 of them in trials on the planet, a few of them are going to make it through safety and efficacy. And we need to all start thinking about how it is that we're going to work it into the lives for ourselves, for our loved ones to get vaccinated. And the sooner we're able to do that, the sooner we'll be able to see some sense of normalcy next year.
Dr. Fauci has warned that there may be a spike within a spike as a result of people traveling at Thanksgiving, and he has concerns about Christmas. What message do you have for the folks about what they can do to protect themselves? And I know that we may be repeating ourselves here.
I'm happy to start. I'm not going to repeat what I just said, although that's really important. But what I would say is it's important for us to, especially from the mental health standpoint, to observe these life milestones, whether it's a sweet 16 birthday party or somebody's retirement or a wedding anniversary or Christmas and New Year's. But we don't have to do it with 50 people around the table. We can choose to do it in a infection control responsible way with 3, 5, 7 people. And I would recommend being really thoughtful about how we're going to observe those milestones and those really important traditions in our families' lives.
Any other speakers wish to respond to that?
One source of helpful hints that I heard was to celebrate, along with what Dr. Luedtke had said, to celebrate everything that can be celebrated over the course of the next month. So St. Lucia's Day, Kwanzaa, Christmas, Hanukkah, winter solstice, New Year's, celebrate everything that you can to keep it a really positive, upbeat time, but just don't do it in large gatherings.
Ms. Thornton-Love?
Yeah, we're kind of working with the families and taking suggestions even from the people that I work with. The clinicians I work with are incredibly creative. So they've challenged families to think about alternative ways to celebrate. Just because you can't do it the way you always did, you can still have a celebration. And we really got a lot of positive feedback about Thanksgiving and things that we suggested to make new traditions or just alter current ones. We definitely saw that it was very difficult for youth not to have those big milestones like graduation or prom. And so trying to figure out ways to do those things in a safe way now, and they can still enjoy it.
And I'm not a doctor, and I don't even play one on TV, but I would recommend Zoom. You can still Zoom with your family, you can Zoom with your friends, and it may not be the same, but it's you're partway there. And one last question. When can we get back to normal?
I'm happy to start. From the public health standpoint, we're on the steep part of the curve, too many cases right now. This is going to continue for some months. We are not going to see big relief in case volumes until at least the springtime. And if we get enough people vaccinated, by fall, when kids are going back to school, we could see a sense of normalcy. It's not going to be the same normal, but it'll be more normal than it is now. Interested in thoughts of others?
Anyone else? Dr. Luedtke, when you say it's not going to be the same normal, what do you mean?
Well, some of that might be good. People have realized that they can do telehealth, and they prefer to not get up and get in their car and drive all the way into the clinic. So that clinical part might be a little bit different. There'll probably be more home teaching and in face-to-face learning as well at schools. Some businesses will have realized that they can do things in a different way, and some of it might be good. But this virus is going to be around for some time. We're going to tamp it down and tamp it down and tamp it down some more, but we're going to see little outbreaks for some time, even after 2021. So it's not going to be a light switch where September 1st of 2021, we all go back to school and go back to work and everything is as it was in 2019.
Okay. Thank you all very much. I appreciate your participation. I believe the public will benefit from this discussion.
This has been our December 4th, 2020 program, COVID-19, Where We Are and Where We Are Going. Before we proceed, I'd like to recognize some gold sponsors. Dr. Sandy Ibarra of the Hearing Associates, Gatos, Churnside and Balthrop, PC, and Pacific Cascade Federal Credit Union. As our Sapphire sponsor, Summit Bank, an independent community bank headquartered in Eugene, serves businesses and professionals in Eugene, Springfield, and Central Oregon communities. For more information, visit sbko.bank. Before we thank our speakers today, there are a few quick announcements. Thank you to our in-kind sponsors, KRVM 91.9 Radio, Pack Info and Simplified Computing, LLC, Dotson's Photography, and a special thank you to public radio station KLCC 89.7 for airing City Club programs on Mondays at 7 p.m. And thank you to Community Television of Lane County, cable channel number 29, for televising recent City Club programs. Our programs are always available on our YouTube channel and on our Facebook page. Next week, we will look at the 2020 election, what took place, and what can we expect at the federal and local levels. Two highly regarded members of the University of Oregon Political Science Department and a former long-serving member of the Oregon House of Representatives will offer insights and their impressions about the national, state, and local elections. You may send questions for upcoming programs to the City Club's Executive Director. The program's moderator will select those questions to be asked for each program. Send your questions to administrator@cityclubofeugene.org. Please join us again on Friday, December 11th. More details and information about future programs can be found online at the City Club's website, cityclubofeugene.org. Now, I would like to thank today's speakers for a great program. Dr. Patrick Luedtke, Dr. James McGovern, Dr. Leslie Pelinka, and Ellen Thornton-Love, LCSW, thank you all for your contributions today. This concludes today's program. Be well and stay safe.